Good, good. Hello, folks. This is once again Shahid Naseem and Sherali in your care, and today, once again, we're doing a live session and a topic with autism. We are trying to do these live sessions on a regular basis and try to educate different on different topics, and trying not just to educate but to spread more awareness and to promote more inclusive language, inclusive atmosphere, inclusive surroundings, just to bring this culture to talk about these kind of situations. So this is a humble try from two not young people but just people. So today we're going to talk about another very interesting topic of autism, and that is the levels of autism and what are the symptoms that causes autism. Like now, I know that we have talked about this symptoms of autism so many times, and there are also so many different videos on YouTube and different other portals that discuss and talk about these symptoms. But today we're going to talk about not just about the symptoms, but a little more than those symptoms and the level of severity those symptoms bring with them, and with not just the level of severity, but also the outcomes and the conditions that put in the position those symptoms put people in. So, do you want to add something, Ali?
Yeah, today the thing we have special for today is we've compiled almost 100 symptoms of
Yes,
autism,
100,
more or less 100
more or
symptoms.
less 100 symptoms.
But Shahid has done something really good. He categorized some of them, not all of them, in the form of level of autism. So
Yes.
the different levels and their symptoms. For example, when you are on level 1 of autism, there is some specific symbols that can point you toward that it could be level of autism, and it can help in the process of diagnosis. And for example, if it's about level 2 of autism, there are some other specific symbols. They can correlate, or they can be is it like that, Shahid, that we have some symptoms in the level 1 of autism, and then the same symptoms appear in the level 2 and level
Yes,
3? Is
yes.
is it like
Yeah,
that?
is it exactly like that? It is very important for all of you to remember this and keep this in your mind that all these symptoms that we're going to share with you, not may necessarily every autistic person should have these symptoms, or not everybody is going to be in the same condition or same kind of situation that we are going to explain to you. It's just that different people exhibit different characteristics, different combination of these symptoms, especially to varying degrees. That is very important. And additionally, symptoms can change over time, and early intervention and support can significantly improve outcomes for individuals with autism. So keep in mind that not only one symptom can be on three levels, but also the severity of level can be different for each person, and each autistic person has different symptoms, could have different symptoms. So it is not important or not necessary that everybody is same, or everybody there is no one fit solution for everybody when it comes to autism or any other disorder for that matters. So just keep in mind that we are talking about symptoms in general, and we have categorized these symptoms into different levels up to our understanding and our research. But these are not conclusive things, and these are not just there is no one fit solution for everybody. So these are just for research purpose and for spread more awareness. Shall we start, Ali?
Yeah, sure. Let's start. Let's dive into the levels list, and then we'll discuss the general symptoms that can co-occur in different levels of autism. How about
Sure,
that?
sure. Let's do that. And we have already established that this is not a standard practice, and autism is a spectrum, and it is a spectrum disorder, and symptoms can vary widely among individuals. However, we are providing you a list of symptoms commonly associated with autism across different areas of development.
Okay, so let's start with the level 1 of autism,
Okay.
which is when we usually talk about it, it's requiring support, not
Yeah.
I think not substantial
Extensive,
support, not other kind of support. Requiring, can we say that it requires mild support?
Yes. On a
Okay.
milder side.
So the first one I have is difficulty with social interactions, such as understanding social cues or maintaining eye contact. One thing about eye contact I want to add here. Sometimes it is not about autism when you can't make the eye contact, because it's about the confidence, it's about the ambience of the room, or any place you are there, because I find it really hard to make eye contacts with people while I'm presenting something in front of a crowd of 20 or 30 people. I used to play music. I used to play in a band when I was in university and college. And what I found very hard, a friend of mine, he was pretty much experienced with performing arts, and he told me that start looking at people's forehead if you're want to make no, don't want to make eye contact with them. This will boost your confidence, and this will give you more chances of being more confident on the stage, and being on the stage, staying there on the stage, because while performing live at a stage, it's really hard to keep up with the pace of the crowd, the energy they're providing you, and the energy, of course, you are providing them. So the thing is, it's not exactly necessary to make eye contacts, or not to be able making eye contacts with relating with autism. But the other things, the social interactions and understanding social cues, those things could lead to the symptoms of autism's level 1. Is that it?
Yes, that is it. And one more thing about this eye contact kind of a thing I want to add here, and that is that if by eye contact we mean that you are talking to somebody, you look at him, and with this intense or with this specific kind of a look, and you talk to them, and usually children, when it comes to children, autistic children, when they are talking to someone, they are looking at somewhere else, and they are talking to somebody else, and that is a very specific kind of a behavior, and you can notice that behavior, that it's consistent, and they are consistently avoiding to make an eye contact. And when you try to hold them, and when you ask them to look in your eyes, it will be very difficult for them, and they will get uncomfortable. That is a sign of an autism. And if somebody who is generally when he speaks to, or somebody who is in in close proximity, or he is generally close to that person, he can talk to him looking into the eyes. But when he's outside and he's not in his comfort zone, and at that time he can't make eye contact, that means that it's confidence issue, or it's maybe the guy is puzzled, or maybe the guy is confused a little bit. Otherwise,
we have got a really nice video on techniques about making eye contacts, improving eye contact in children, and it's about it's there on the disorder scale. It's about, you can use facial stickers
yes,
for making children look into your eyes and start making eye contacts, because with practice and with passage of time, you can simply practice this thing. If you lack some social skills, or if you lack eye contact, it's not a big deal, because you can simply improve it, and you can follow the path of others to just to make it happen easily. Oh, okay. Would you like to move to the next one, or do we have something else to more?
okay, let's move to the next one.
Okay, the next one is challenges in forming and maintaining relationships. That's a huge debate nowadays, because most of the time people find it challenging when they are forming relationships, or even the relationships that you're already assigned by birth. For example, your biological relations, for example, parents, brothers, siblings, and all of those. These relationships, to keep up with those, how do people find, as we are talking about the level 1 autism, they require support, right?
Yeah, obviously, when you talk about relationship, the most common, or the first thing that comes into mind is your siblings, because if you're an autistic kid, then you know that it's a lifelong condition, and when you're raising a kid who is autistic, or if you yourself is an autistic child, then your first interaction that comes with it, that is a bit competitive, or you can say that's first hand and you're a bit competitive, that is your siblings. So it becomes a bit hard for you, especially if you're a parent, and you're raising a kid who is autistic. So the first relationship that you come into contact with is your siblings, because I'm not saying parents, because obviously you come in contact with your parents first, but your parents are more empathetic towards you. They try to nurture you, they try to raise you good, they are kind of a helping hand towards you. But your siblings, that sometimes siblings can be very competitive. I think most of us can relate with this statement, that siblings can be competitive, and they can compare themselves with you, and if you are getting some extra care, or special care, or something out of ordinary or out of normal So they might not understand that you need this kind of support from your parents. So they might think that you are getting some special treatment and I'm not getting that kind of a special treatment. So this can create a special kind of competitiveness between siblings. In that condition, an autistic child might not understand what his sibling is thinking or what his sibling is feeling, and that would obviously affect his relationship. And normally, if an autistic child, the second thing that comes after the siblings relationship is friendships in schools or preschool or after the schools, to make a friendship with other, because obviously you are not looking at the world in other people's perspective, and you are not looking, you can't understand sarcasm, you can't understand jokes, normal jokes, and you can't understand the normal behavior, the behavior kind of behavior people do.
And that's our next
reason.
symptom too,
Yes.
actually. Difficulty understanding others' perspective or emotions.
Yeah,
That's the next one too.
Sometimes what happen with autism is, and that is one of the symptoms, and that is that you do not have that kind of an empathy that usually people have. It does not mean that you don't have empathy. It obviously every autistic person does have empathy, but the way they behave with that empathy is quite completely different. For instance, if a long distance relationship, for example, your second grandma or your sister of your grandma dies, it could affect other people, but it would not affect an autistic child. So, or it might affect more than a normal level. So these kind of this abnormality in these feelings, or getting overwhelmed with a very small news, or not getting any reaction from a news, this could be a things which can set you apart from the other people. So you might not understand others' emotions, you might not understand what they are forming, or what they are what this perspective or what they are feeling. So that could be a problem. You, for example, a simple game could be meaningless to an autistic child, and another meaningless for somebody's meaningless game could be very interesting for an autistic child. So they might not understand the usual what you call a parallel paradigm of understanding or easiness or emotions.
Okay, so the next one we have here in the list, because we discussed two symptoms, difficulty understanding others' perspectives and emotions, we are already done with that. So it's about repetitive behavior, which is quite a debate nowadays.
Yes.
Like, for example, rocking, flapping hands, or repeating words or phrases, which is also called echolia. So this thing is really there for autistic individuals, and there are a lot of other as equalia is nowadays discussed as a separate entity, as a separate thing. When we are searching online about, or we are doing research, or when we are asking someone for the symptoms of autism. So the symptoms of autism are, for the level 1 autism is also equalia, but equalia is a separate thing for individuals too. Sometimes none of the symptoms appear in a specific individual, but just equalia is there. For example, a kid or a child, or even an adult, or a female or male, it doesn't matter. He used to repeat phrases, or some specific kind of behavior. For example, he's flapping his hand, or turning around in circles when he's not playing, or because
or jumping on the toes.
Yeah, so they
not putting the complete foot down on the ground.
Exactly. So these symptoms, when they occur in an individual, if they occur, if more than one symptom, for example, it's not just about equalia, and it's about the other symptoms. For example, we discussed the social interactions thing, and maintaining relationships, finding it challenging to maintain relationships, and difficulty understanding emotions. So if more than these one symptoms occur, so it's autism then. Can we say that?
First of all, can you please check? I think our comments are off. Somebody just texted me that our comments are off.
Okay, let me
we
check.
Can't really comment. Okay, one thing that is, let me come to this point number 4. It's I don't know if the correct pronunciation is correct. It's echolalia or echolalia. I'm not really. We are not good with pronunciation, so please take a look at that on your own risk. Okay, repetitive behaviors. Repetitive behavior is a textbook symptom for autism or for any other disorder, because repetitive behavior is something which can be quite easy to monitor or easy to look out for. when it comes to autism. And most on top of the list when it comes to repetitive behavior comes flapping hands, jumpings on toes, or just toes, not putting the complete foot down for kids, and repetitive words or phrases. This is a textbook symptom for autism, and this is very easy to notice. And if it happens in early age, and usually it happens in a very early age of childhood. So when it happens, it gives you a call for early intervention, and that could be a life-changing event for an autistic kid. So this is very important for you to understand that if an early intervention happen, it could completely change the way or the course of the life of that autistic person. So if you see this behavior in any child in your care or in your house or in your surroundings that has these kind of symptoms, that he is doing something on repetitive behavior, that could fall into repetitive behavior. For example, if he's flapping his hand quite consistently, it could not happen all the time, but it can happen when he's upset or when he's excited, overly excited, or he's overwhelmed, he or she is overwhelmed. So they can do these kind of things when the emotions state is not normal for them. So they are either go high on the spectrum or high on the emotion side, or the low on the emotion side. They're feeling down, they're feeling excited, they're angry, they're frustrated. So at these times they do these kind of things. So if a child is jumping on his toes, maybe on one toe of the one toe, or maybe on both toes, and he's not putting the feet down completely, that could be a sign for autism. And if somebody is flapping his hands or repeating his hand, or just swinging his head, that could be also a sign for autism, or a test you should or a sign that you should go test your kid.
Okay,
Or
it's
evaluate your kid.
echolalia. I was pronouncing it wrong too. Really
Okay.
sorry about that. Pronunciations with English words, some of them that we hear very less.
Yeah, there is a not
Usually.
accurate. Okay, then comes the reference for routines and difficulty with changes in routine or environment. Yeah, that's again, if you ask me that what could be the textbook behaviors or textbook signs for autism, that the first would come the repetitive behavior like rocking and flapping hands, etc. And the second would be routines, preference for routines and difficulty with changes in routine or environment. Now, before moving on to this fifth one, it just reminded me another thing, that when we say that repeating words or phrases, that does not include stuttering, that does not include any other kind of speech disability or speech difficulty. That is a completely different thing. You should get your child check if he's having this problem, that if he's stuttering, or he's having difficulties pronouncing the words right in an age where he should be pronouncing them correctly. Okay, moving forward to the fifth point, where we said preferences for routines and difficulty with changes in routine or environment. That is very important one, and we do not mean that preferences in routine means that you like to have a specific routine. No, that does not mean it. If you like to have a routine, that's quite normal, that's okay with you. And if you like to have some routines, but that when those routines get changed, if you somehow can manage with that thing, that's okay. But if somebody just completely lost it, and if somebody start having meltdowns or breakdowns just because the routine wasn't followed, that's a sign for you that there is something there, and you should
It's
evaluate.
in simple words. If we say that if your routine changes, you find it difficult or almost impossible to perform a specific task.
When we're talking about it, it usually happens obviously with child. If you are adult, or if you are obviously if you are past the 14 years of age, that means that you have already found out these kind of habitual things, that you have already lived almost 14 years, and you know these things about yourself. We are talking about children. If a
child's
if
routine.
a child is throwing a tantrum, or or a severe tantrum, or if child is breaking down or having a meltdown just because a certain routine wasn't followed, and if this behavior is repeated, if he's repeating this behavior not just once,
Every time
but
the
every
routine
time
changes,
the routine changes,
Uh-huh.
he just goes off, and he just throw a meltdown, or he just throw a breakdown, then it means that you should get your child evaluated. There is something there.
Okay, so the next one we have, let's moving forward to the next one, sensory sensitivities, and it's something very related and very important to level 1 autism. Almost I think all levels of autism, but the level 1 autism usually indicates this, such as, for example, being overly sensitive or under responsive to sensory stimuli. is sometimes people like to touch some specific sort of substances. Or for example, I really like these silicone covers on iPhones and almost all the phones nowadays. Sometimes people like to play with bubble sheets. So it's something not exactly sensory sensitivities. Sensory sensitivities are, for example, if something is disturbing you, a specific kind of texture or a specific kind of sensory stimuli. For example, if the texture of your bed sheet is not according to you, it could help you in sleep or not let you sleep. But it's not that when you're talking about the level 1 of autism.
Yes, and one thing about these sensory things is that any kind of loudness, any kind of light sensitivities you have is not a sign of autism. Obviously, these things also happens in very early in the age. For instance, I mean, when your kid is young and or when a child has these kind of things when he goes into crowds, this could be with the touch. If somebody is touching you, you could have those kind of sensory sensitivities. You could be sensitive to a touch, you could be sensitive to light, you could be sensitive to environments, smells, smoke. So there could be a lot of things that could affect you in different ways or could affect the child in different ways. So you need to get this also checked, and if you think that a child is having a meltdown or a breakdown or he just loses his composure whenever he's outside or in a crowded place, then this is also a sign. Not just we are not talking about a one time event. If it happens once, obviously it can happen to anybody, but if it's a kind of a thing that happens every time when you go into that specific situation, then it calls for attention.
So in short, let's say processing sensory stimuli and information more strongly and deeper
Yes.
than others,
Yes.
then it's a sensory sensitivity for autism
Yes.
level. When we
And if it
discuss
happens again and again in the same situation. Now, difficulty with transitions or transitioning between activities. Now, this is also a very important one, and this one is a bit tricky one. People do not understand this one. For autistic people, it is very important for them to know, especially for children that we are talking about. Especially for children, it is very important for them to know that when is an activity is starting and when is that activity is going to end. So, if you do not tell them that that activity is that activity is done, we are done with that activity, and after we do this activity will be over and we'll start this one. For instance, if you're playing with your child and you want them to end that game, and then you want them to go to bed or sleep or go to have a dinner or something like that, you have to put them in there exactly in this manner, that we will play for 10 minutes or maybe 15 minutes, and then we will do this, and then this whole activity will be over, and then we'll go to bed or we'll go to dinner, to go to have dinner. So they cannot transition from one activity to another. For instance, a normal child, a normal kid could be doing one thing in a moment and then just leave it in the middle and go do something else. Or you can ask him that, okay, leave this and let's go outside, or let's go do something else, or let's go have dinner, or let's go to sleep, etc., etc. But for an autistic child, it is very difficult to leave something in between, or the concept of ending something or getting
Closures,
over.
in short.
That is very, not just closure, but even if that thing in its own sense is completed. Like for example, you're playing a video game and the video game is ended, or if you're playing a board game and the board game is finished, you can move on, you can go to other things. But for an autistic child, it could be very difficult to move on and do something else. So before they have started doing that, they need to know that they are going to do this kind of a thing, and this thing will be over when this thing happens, and then we'll do something else, then we'll do that thing, or do those things. Okay. So they need to know these kind of things. So transitioning from one thing to another thing, one activity to another activity, not just because the thing is finished, it is very difficult for them to move on to another thing.
Okay,
Not
we have two comments. First of all, Michael is saying hi.
Hi, Michael.
Maybe. Hi, Michael. And Earth in Anjamas. I don't know who's the guy behind it, but it's saying he's saying that really great listening
Again,
to you
I think
guys.
it's
Thank you very much.
Earth Enigmas.
Enigmas, really sorry.
Yes, Earth Enigmas. Earth Enigmas, thank you so much. And Michael Wu, I guess. Michael Wu.
Michael.
Michael, not it's Michael, it's Michelle.
It's Michelle. Really sorry,
Michelle Wu.
I have lights in my eyes, so I'm finding it hard to
Mitchell
read
Wu or
something here.
Mitchell Wu or Michelle Wu. I
Michelle
don't
Wu.
know which one is right, but who Michelle Wu.
I would like you to type your name in like pronouncing words.
Yeah, exactly.
If
The
you
word
want us to
exactly
pronounce
sound-
it right.
Take us as an autistic kid also.
Okay.
Uh,
So the next one is specific intense interest in certain topics or objects. Almost we can say that obsessions towards topics and objects. When we talk about some, for example, I've got a really great example here. If you've seen The Big Bang Theory, we really really quote that guy again and again.
Yeah.
Sheldon Cooper was really obsessed with trains.
Yes.
He liked to talk about trains and flags. Actually, he had a program on a YouTube program, I think, on flags. He used to talk about different flags, what do they mean, actually going deep into the information, and to be obsessed with some specific topics and objects also. Sometimes we find ourselves attached to a specific topic, and then when we are almost 2 days, after 2 days or 3 days or even a week, sometimes it's about a month, or the time could vary, but after some specific time we find it that we are done with that topic. Like, I've had enough of this topic, I'll come back to it a later day. But I think autistic people, we are talking about the level 1 autistic people. When we categorize them into level 1 of autism, they find it intense interest in specific certain topics and objects.
Yes, and these interests doesn't have to be obsessions. It's not necessarily for them to be obsessions. It's just keen interest, and they could be more focused in these interests than anybody in your surroundings, or anybody we usually call normals. So the intense focus. That's why when we talk about famous personalities, and we take these really focused and committed guys, and we misjudge them, or maybe we suspect them as an autistic person, is because the kind of intensity and the kind of dedication and focus they have, we don't usually normally see these in different people. So that is why we say that these people could be autistic. Okay, the one after that is difficulty with the executive functioning skills, such as planning, organizing, and problem solving. Obviously, again, this one is a pretty, top of the list, and we can call it a textbook symptom of autism, and that is functioning skills. For example, just starting out the day and planning small things and arranging small things like your day schedule or your school schedule, or how you're going to spend your day. The coming ahead, this could be a problem. Like, just as simple as it could be folding your bed or making your bed for night, or after you wake up, it could be a challenge for an autistic kid, or he might just not know what to do when he's wake up. So he needs to be told that you need to do this, or you need to tell them that this is how you're going to do these things. And that is why these schedule books or schedule boards are really supportive for these kind of
Exactly, there are
events.
schedule charts in the room. You can put the chart in the room, and the idea is to tell your child step by step that what to do when he wakes up, or he wants to do his homework. So how to start his homework, how to organize it, which subject to do first and which subject to do last. And it's actually it can vary from time to time. It depends on what type of attention and what type of detailed interest a specific type of task need. For example, if he or she is having their exams, and they want to study for the exams, and they want to prepare it for a test or exam, both of them, what you can actually do is you can give them a schedule, prepare them a schedule. He'll do it or everything else by himself. You just have to prepare the schedule first, that starts studying the objectives first, and then the subjective questions. For example, start learning the short questions first, and then come towards the long questions. And or in another technique, you can do start learning the formulas first, for example, if it's about maths, and then come towards solving the questions. So this way, or it can be vice versa. So this way, it will be easy for an autistic individual to organize and to do executive functions if he's finding it hard. The next one we have here is delayed or atypical language development. I have a question here, Shahid.
Yes, please.
I know the basics that what atypical language is. But what exactly, what's the detail of atypical language? For example, the basic is the development of language which does not follow the usual patterns or sequences. But
Okay.
what is the example of atypical language? For example, is atypical slang an atypical language?
Atypical, I mean, I'm not the expert here, but I mean, if you have to ask me, that I think that it's a major developmental feat. Typical language could be, I mean, any acquiring language skills could be, it could fall in this, but normally atypical we call it, it's a condition.
Okay.
And there's, in fact, there's a very good season with this
Atypical, yeah.
yeah, atypical.
It's
It's a really good season, and the lead character is also autistic. So majorly it is associated with autism and autistic personalities, and when we already say that asexuals, I mean, there's a lot of terminology that comes with this. So in its origin, it's somewhere around in the general, in what you call a neutral terminology. It is used.
Mhm.
So I think whenever we talk about atypical language, then we are also saying that atypical language development may be broadly divided into speech, sound disorders, and language disorders, somewhere around these terms, and is commonly found in children who have difficulties producing certain speech sounds, or may have trouble with fluency and voice. So I think that somewhere around where the neutral part of the language comes, it falls there. But
Okay.
I'm no expert, obviously.
Okay, what about the motor coordination difficulties for autism? For
Wherever
autistic
your
individuals?
motor skills are involved, that's where it comes in. I mean, your motor skills are, for instance,
The movement ones,
yeah,
coordinations,
all those skills that falls under movements. Your
and
motor skills.
it's about dysgraphia or dyspraxia, I think. Dysgraphia is actually not dyspraxia, but dyspraxia is about motor skills. It's
Yeah,
another
these
disorder.
These are two different disorders, but they can overlap. On
Autism has
Yes.
overlapping
Yes.
disorders with it. For dyspraxia, also known as developmental coordination disorder, it's also called DCD.
Yes.
So DCD is also about the motor skills and finding it. It's a chronic condition, by the way. It begins in the childhood that can cause difficulties with motor skills and coordination. So those symptoms can overlap in autism. So if an autistic individual have dyspraxia's symptoms, it doesn't mean that he has dyspraxia exactly, but it can overlap in autism. Those simple symptoms can overlap.
Yes, and in general, when we're talking about motor skills, motor development skills, or just in general, when we describe it, developmental coordinations, it means that everything that comes with your motor skills, your movement skills, or everything that could be affected. It's not likely to have in level 1, but it could happen in level 1 also. Usually we see these kind of cases in level 3, where the autism affects you not just on your behavior or your conditions or on your mental skills, but also on your with you on physical level. So it more happens in the later stages of or you can say that on the severe end of autism, not just in the milder end, but it could happen, obviously.
Okay, so we are moving towards, this was the last one in the list for if we categorize them in levels of autism. So we are moving towards the level 2 of autism, which is requiring substantial support. I have something to share with you guys, and I'll share just the one-liners here. So if you want to put it very simply, I have examples. For example, there is a guy, Alex. There is a kid, Alex. Alex finds it challenging to initiate and maintain conversations with others. He may struggle to understand social cues such as facial expressions and body language. And when we are talking, it's about social communication. And when we are talking about repetitive behaviors or restricted interests, Alex engages in repetitive behaviors such as hand flapping, rocking back and forth, or spinning objects. Now, if we talk about sensory, I'm giving these examples so to understand the word substantial support.
Just
So
to
where will we need?
just to add a single word in there, single sentence in there. But rocking forth and coming means that when you are moving like this and that, this is called rocking.
Like a rocking chair.
Yes.
So this is about the sensory sensitivities. Alex is highly sensitive to sensory stimuli such as loud noises, bright lights, or certain textures. He may cover his ears or become agitated in response to sensory overload. For example, if the noise is too loud, if the sound is too loud. Sometimes some autistic individuals find it really really calming when they used to listen to some ASMRs. For example, there are a lot of ASMRs. We are trying to do something in that department too with
Yes.
disorders care. We have some specified, and we have done some research based frequencies, which are the frequencies are actually, there are some specific kind of frequencies which you can hear or listen to while sleeping or studying. There are different frequencies for different type of things. For example, there is 433 hertz, 432 hertz, or even nowadays people are trying to listen to 43 hertz. It's the specific frequency for you to focus. So if you're finding that's for ADHD, not exactly for autism, but you can still use it if you have an autistic individual. And there are some frequencies to help you sleep. Most of them are found in pads. Not pads are the form of music. When you play pads, it's like a choir sound. It's going on and on. It's like a synth. And there are rains ASMR. There are eating ASMRs. There are different type of ASMRs. Fan noise, white noise, gray noise. There are different type of noises for your sensory stimulations. Coming back towards sensory sensitivities. Alex may have specific sensory preferences, seeking out certain sensory experiences such as spinning objects or watching moving lights. And if we are talking about functional impairments due to his challenges with social communication, repetitive behaviors, Alex requires substantial supports in various settings, including school, home, and community environments. He may need assistance with activities of daily living such as dressing, grooming, and mealtime routines. Alex's parents and caregivers work closely with therapists and educators to develop individualized, as we are talking it about right now, individualized strategies, not the same strategies for every individual. If there are two autistic individuals in the same classroom or in the same household, both of them needs for both of them would be different, because both of them could be
Yes.
sensitive to some different objects.
There is no one-stop solution. For
Exactly. So moving towards the symptoms, Shahid, please.
Yeah, this is the more pronounced challenges and with social interactions and everything. The first thing that comes in level 2, or we can say that requires more support than substantial support, or as compared to the level 1, is communicating. That is the foremost thing in level 2. That it will be difficult for the child to communicate with others, or to convey what he's trying to say, or what he's feeling or she's feeling, or what the others are trying to communicate to them, if they might not understand. Then comes the difficulty in initiating social interactions or responding to social overtunes from others. So obviously, once again, the communication problem. He or she might not know how to start a conversation, or how to start just any if they want to say something, they might not know how to start that conversation or that dialogue. So again, an interaction problem. Limited interest in or awareness of others' feelings. That's again, a very important one. We have discussed this one before also, that you might feel that they not have that kind of an empathy that you normally expect, or the kind of empathy that you have, but they do have empathy, but it is difficult for them to show that empathy, or for you to understand that empathy. But if you look close enough, you will find it, and you will see that empathy. For instance, if somebody is falling near an autistic child or an autistic person, they might not react as quickly, or as you suppose them to be, or as you want them to be, or as you expect them to react. They might not react that way. Or if you're in need of a helping hand, they might not ask you for that. They might not ask you to help you.
Okay, the next one is intense focus on specific topics or objects, as we discussed that
Yes.
in the level 1,
Yes.
and it came again in the level 2, but there is an
Yeah,
addition to
obviously
that.
the severity will be different here, and
Sometimes it leads to the exclusion of other activities.
yes.
So it becomes an individual becomes obsessed, or so much interested in a specific task that he leaves other activities out. He excludes them from his routine, or
Yes.
from his interests, the list of interests. It's that.
And that makes them so good in so many things. I think this could be a very I think supportive for them, if somehow they had an early intervention, and if they can focus this intense focus on positive thing, or something in which they are really good at, and that thing is also important for them, and that is also beneficial for them. It could lead them towards something really great, and we have seen a lot of cases in this pretext. Like for example, we have talked about Temple Grandin, we have talked about other famous people who thought to have this condition. For Anthony Hopkins, we have thought about so many other people who supposedly or who very well possibly have these conditions, and just because of their this intense focus, and this intense focus was directed toward the right way, it worked miraculously.
Okay, so you want to say that they can use their
Yeah,
weaknesses as a
this could
strength.
be their superpower.
Yeah,
This could become their superpower.
yeah, they can use this as their strength.
Just imagine a scientist who has the capacity to do wonders, but he get lost in other different kind of things, or he get distracted by other things, or he's just too lazy to do the research. I mean, it doesn't matter how much potential he has or how much of a genius he is. He'll just be a nobody in the next 10 years or the next 20 years. But if he has the potential, and if he has the genius that requires the thing, and above everything, he has that intense focus to work on that specific field or that specific problem, that whatever he's gonna do. So if he, for instance, for Einstein, I mean, obviously he was a genius, obviously he was a super scientist, everything. But if he didn't have that kind of focus, I mean, nothing would have been achieved. And whatever he has achieved, nobody could have achieved that. E is equal to mc square cannot be achieved by a man who doesn't have super magical kind of focus thing.
Okay, moving towards the next one, difficulty with excessive functioning, leading to challenges in daily living skills. Now, what we were talking about
difficulty
before.
with executive functioning, leading to challenges in daily life skills or daily living skills. Obviously, all those executive functioning that you require in your daily life could be a challenge for them. We've already discussed about this, that just as simple as making their bed could be a challenge for them, or brushing their teeth, or just cleaning their room could be a challenge for them. They might not know how to start their room, how to start their day, or how to schedule everything in their life. That could be a problem for them. So all these executive functioning could be a problem for them.
Okay, moving towards the next one.
Pronounced sensory sensitivities that impact daily life. We have already discussed this one. Difficulty with transitions requiring significant support. Now this was also very important. I've already
And please relate it to the level 1 of autism.
Yeah, I've already explained this in quite the detail, that transitioning from one activity to another activity could be a big problem for them. Not the activity. Transitioning from one setting to another setting could be a very big problem for them. For instance, in moving from one house to another house, if you're just moving to another place, could be a very big problem. Moving from one school to another school could be a very big problem for them. Moving from one job to another job could be a very big problem. Just changing the clothes, for instance, at the age of 8 years of old, they had a specific kind of a jacket, and then the child grows, and in 9 or 10 years he needs another new jacket. That could be a problem for them to just change the jacket or change the shoes or something like. So in any set conditions, transitioning from one kind of a condition or one settings to another setting could be a very big challenge for them, and they could create they could have meltdowns, they could have breakdowns, and they could feel very uncomfortable. So this I mean, obviously this changes from one level to another level, it becomes severe.
Okay, the last one we have not last as a whole, but last one for the level 2, requiring substantial support in limited and the symptom is limited verbal communication or reliance on alternative forms of communication. For example, texting or writing things on a board.
Yeah, they could give more hand signs,
hand gestures instead of
talking, or instead of using words, or just saying something they want to say. It could be a problem for them to say something outright, or they might not find the right words to say that. It becomes again to the primary problem, the communication problem. They might not have the ability, or they might feel quite challenged to communicate with someone, and maybe that thing could be a very simple thing, but it could become a problem for them to communicate. And as the level of autism increases, or the severity of autism increases, or if you go on the upper side of the spectrum, the verbal communication becomes less and less and less. So on a milder stage, they have some other kind of conditions, but when it becomes severe, the verbal communication is the thing which affected the most. Not all the cases, but usually.
Okay, now we have the symptoms for level 3, which is requiring very substantial support. Where I want to add something here because as we move upwards toward the spectrum, by upwards we mean if we start from the level 1, like a graph. If we move upwards, the support for the symptoms are almost overlapping with each other in all the levels of autism. But the support they require and the intensity of the symptoms, for example, the simple communication problem was in level 1 autism. They required less support, a very little amount of support, even sometimes just moral support, nothing else. But when we talk about level 2 of autism, they require substantial support. There should be some proper support to help them communicate the things they want to tell to talk to others about. But when we talk about the level 3 autism, which is also called the severe form of autism up until now, it's about requiring very substantial support. So whichever symptom we are talking about and which we have talked about in the level 1 and level 2 of autism, those symptoms can reoccur in the level 3 of autism, but the problem would be the severity of those symptoms and the support required to overcome those symptoms or make them function. The support would be much greater than the level 1 of autism.
Symptoms. And the first that comes is the severe challenge with social interactions and relationship. What is social interactions? The most important problem and the most common problem among all autistic person is mostly, not all the time, but mostly it's social interaction, it's communication. So they could face a lot of problem, a lot of challenges in this area. They might not be able to communicate with others properly. It could be as simple as somebody's asking you the right way, or somebody's asking you directions that I want to go there, do you know where you should go? And they will start looking right and left, and they might not be able to communicate with that person, and they might not be able to tell him that which way he or she should go. They could know very well that where is that place that the person is asking, but they might not have the ability to communicate properly, or they might feel challenged to just tell him that there or where he or she should go. So the main problem will be communication. Minimal interest in or awareness of others. Obviously, this comes right on the top of the list, and that is minimal interest. They could lose complete interest in level 3 of autism in different things, or things that do not interest them. They can completely lose interest in those kind of things, and they could be just in the middle of that thing, and they might not feel affected by that at all. For instance, they could be in the center of a concert going on, and if they are not interested in music, or if they are not interested in that setting, they'll be just like they are not even there. They're just in a completely different world, and they'll just pass through right it, and they won't feel it. And somebody can get amazed, or that somebody can get somebody can wonder that why that music is not affecting them, and why they are not dancing, and why they are not for instance, if they are going through in a funeral, or especially in these kind of situations where a wedding is going on, or when there is a funeral, somebody might think that why they are not sad, or why they are not happy, or why they are not enjoying that. It's just because they do not that thing do not interest them. They might not have the motivation to feel as others are feeling. Intense focus on narrow interest, often with repetitive behaviors. Okay, so the level 3 is limited or no verbal communication using alternative methods. That is also, I've already discussed, I think the most important thing at this stage and at any other stage is communication. The first thing usually that get affected is their communication skill. The harder the scale is, the harder the level is, the communication skills get affected. So again, limited on or in level 3 there could be no verbal communication, and I have seen cases on no verbal communication. Level 4 is intense focus. That could be a blessing, but at some cases that could be a very dramatic and very tragic condition. It could create some tragic conditions, and most of the time when we are talking about autism, it's not like in movies, or it's not like in seasons. It's a very difficult condition, and we completely understand that the life of all these autistic people are not easy. It's a challenge in process. It's a complete challenge, and that is why we are trying to spread this awareness, and we are trying to talk about these kind of issues. that it's not a path we can say that that's easy to walk. It's a very difficult thing to walk on. Number 5 is severe sensory sensitivities that significant impact daily functioning. Now that this is one is very important one. We have talked about severe
Sensory.
sensitivities like light or crowded places or these kind of things. But in this level, it could be as difficult as just going to for a grocery shopping or going to office where more than 30 or 40 people are sitting in a same room or same hall. This could be a problem for them, or just a noise, for example, a clock ticking noise, or a noise of a doorbell, or noise of typing, or somebody smoking, or noise of somebody's breathing. These could be a problem for them, or somebody's trying to shake hand with them or trying to hug them. It could be a problem, and even that person could be their mother or their father or their loved one or their partner or their siblings. This could be a problem for them.
Yeah, there are cases where people don't like sunlight.
Yes.
Some autistic individuals don't even like sunlight. They
Yes.
actually hate it. It's nothing about their physical conditions. For example, it doesn't affect their skins or it doesn't affect their eyes. Nothing like that. But they don't simply like it. They hate it because there is heliophobia, and it's different than what this sensory that is. But the thing is that if they don't like sunlight, it will not affect them physically, but it may be disturbing for them because they find it too bright for their eyes, or they find it really disturbing for them. So the next one we have here is extreme difficulty with transitions and challenges in routine, as we have discussed this before for the other two levels. And now the words just changes to extreme difficulty. So there was difficulty with transition requiring some significant support in the level 2 of autism, and it was just difficulty with transitioning in level 1. But now there is extreme difficulty, like you almost find it impossible to transition from one activity to another. Moving towards the next one, severe challenges with executive functioning impacting all areas of daily life. Now the thing to note here is that executive functioning was not that much easy for the level 1 and level 2, but here we have the severity of it increased in the level 3 of autism, and you find it almost impossible to move forward with your executive functioning in your daily life when we talk about an autistic individual.
Yeah, and by this we means that just waking up, going to washroom, going to making your bed, having breakfast, and then coming back and having tea and sitting and just leaving your room could be a problem for these people. So the life could be very challenging for this level of cases. Severe challenges with executive functioning. After that comes difficulty with motor coordination and physical activities. Yeah, this one is the most difficult part is when there's not just the challenge where it's involves your psychology, but also your physical. You have physical challenges. Your motor functioning is not correct. Even if when you talk, you could have a motor functioning problem that you cannot pronounce the words correctly. You're having difficulty pronouncing the words, or just keeping up the conversation could be very difficult. Your jaws might stand with you, and your brain might not work that efficiently, and it could be that your body doesn't work that efficiently as it should be. So these kind of problems could happen in level 3 autism.
So the next one is high levels of anxiety or emotional dysregulation.
Yes, high levels of anxiety is that obviously anxiety, it just becomes on a different scale or a different level. So this is also a very common in level 3 autism, and it happens on a completely different level. Level 3 requires substantial support, not just substantial support, very substantial support, and it could be very challenging for all these people. Number 10 is need for high levels of support in all areas of life, including personal care and safety. Personal care and safety, as I've already told you that in level 3, just waking up, making your bed, or having breakfast or going to washroom could be a problem for that autistic person, and it is very challenging. And obviously it also includes their safety, so that it could be in different cases it could be a problem of their safety. So it requires substantial support, very substantial support, and that is why we're trying to make these videos, trying to spread this awareness. And at the end of this conversation, it's very important for you to note that these lists are not exhaustive, and individuals with autism may exhibit a combination of these symptoms to varying degrees, completely varying degrees. Additionally, symptoms can change over time, and early intervention is the key. Early intervention is the key, and support can significantly improve outcomes for individuals with autism.
Yeah, we just want to add that, as we say it again and again, I'll say it once again, that it's a spectrum. The symptoms and the causes and the things you want to notice can overlap with each other and
Yes.
other disorders too. There
One
is
person can have different symptoms, the other person can have completely different symptoms. One person can have multiple symptoms, and the other person could have only
Just
one symptom. So
one
there is no
symptoms.
one fit solution for everybody. So everybody need to have his on not just the categorized the solutions, but devised. There is a need to devise a solution for every person differently. We need to get everybody differently evaluated, and the outcome is completely different for everybody.
exactly, and there is an overlap of autism with other disorders too.
Yeah, that could also
For
happen.
example, ADHD, dysgraphia, dyslexia, and we have discussed this in so many videos of ours in the disorders care. But the thing is that the support each person requires, each individual requires, depends on the symptoms he already have. So he's showing some symptoms, and the support he requires are in those specific tasks or those specific things that he's requiring this specific support for it. So I think that's all for today.
Yes, that's conclude our today's session. Hopefully you like the session, you learn a thing or two. If you want to share anything, do share it with us. If you want to share your personal experiences or something that you think that we should talk about, or that we should correct ourselves if we said something that you think is not correct or not right, or it was against your personal experiences, or if it is not according to, or it's not on the level as you experience it, please do let us know. I will really appreciate